Hello everyone, I'm FIKRI. I would like to share about the important skill for filling and dispensing medication. First and foremost, we must interpret the prescription correctly. In order to interpret the prescription correctly and quickly, we must familiar with the abbreviation used in the medical field. For example here, the frequency is 4 times a day, wrote as QID, and the duration is 1 week, wrote as 1/52. In terms of the drug names, we need to know both the drug's generics and brand name. For example here, the generic name of the drug is celecoxib while the brand name is Celebrex. Then the generic name is dexamethasone eye drop while the brand name is Mesidex. Lastly, we should master the basic calculation. With that, we know how many insulin pen we are going to supply or how many tablets we are going to supply. Now, let's look to the example of the prescription. Written there, tablet PCN 1 gram QID and capsule Celebrex 200 mg OD, both to be supplied for 1/52. So, the interpretation should be tablet paracetamol 1 gram 4 times a day and capsule celecoxib 200 mg twice daily, both to be supplied for 1 week. The second example here, written there, got Vigamox 4 hourly and got Mesidex QID RE for 2/52. So the interpretation should be eye drop Vigamox, which is the moxifloxacin, and eye drop Mesidex, which is the dexamethasone, both to be inserted into the right eye for 2 weeks. Now, it's time for us to fill the medications. While filling the medication, it is essential to choose a suitable envelope. We need to ensure that the size of the envelope fits the drug, not too small and not too big. All the drug will be inserted into the same type of envelope. Some of the fresh items such as insulins and Zalatan eye drop need to fill into the blue color envelope. It is because this item needs to be stored in the fridge. Then, the black color envelope will be used for the drug that is sensitive to the light to protect the drug from being exposed to the light. Example of drugs include ascorbic acid, hydrocortisone tablet, and phenytoin capsule. Next, I would like to share the correct techniques to label after we finish filling the medication. While labeling, we have to bear in mind that the name, strength, and the expiry date of the drug must be seen clearly. As you can see here in this picture, we should not paste the label to the envelope on the side where the name, strength, and expiry date of the drug was printed, but we should paste the label on the another side as shown in this picture. Let's move on to the skill of dispensing medication. Once they are in front of us, the first thing we must ask for the patient's detail, such as their name. It is because we want to ensure we dispense the medication to the right person. While explaining, we need to avoid using medical jargon. Instead, we should use the term that the patient can understand. For instance, when explaining the indication of the paracetamol, we should not say this is an antipyretic or analgesic agent, but we mention to the patient this medication is used to treat fever or painkiller. Last but not least, asking back the patient about what we have explained is also a good practice to ensure that they understand well. Thank you. Now let's move to the next part.
Next is essential step when preparing medication by AZIF JASNI. Hello everyone. In this video, I would like to share the essential procedure when preparing medication in gynecological department. I will show some of the important technique with a few examples. Before preparing anything, it is crucial for us to create a worksheet which is a gynecological worksheet. Gynecological worksheet contain all sorts of important info such as product batch number, expiry date for raw materials, method of preparation, and also the product prepared by who. The Galenical worksheet can make counter-check for final product is easier for pharmacists. Next, when the worksheet already prepared and approved, we will clean all the apparatus needed. After all the cleaning process, we will dry it with clean tissue. It is because cleanliness is very important when preparing pharmaceutical product. After that, we will continue all the process by checking once again each product batch number, expiry date, and the name of the raw ingredient before start pre-pack or prepare any drug. We must make sure all the raw materials info are the same as the worksheet. After we find out all the information are correct, we will proceed with the production of the medication. In this video, I prepare potassium chloride mixture. Usually, potassium chloride mixture used for someone who have potassium depletion. Labeling process. Before labeling, we must make sure all the batch number and expiry date stated, same with the worksheet. Lastly, we will store the product in Galenical store using FIFO method, first expired, first out. That's all for me. Now, let's move on to the next part.
Next is Important Communication Skill by IQMAL FAHIM. There are 4 important communication skills that need to be known. The first is confidence. Second is non-verbal communication. Third is respect. And fourth is listening. The first important communication skill is confidence. It is important to be confident in your interaction with others. Confidence shows your co-workers that you believe in what you are saying and will follow through. Exuding confidence can be as simple as making eye contact or use a firm but friendly tone. Avoid making statements sound like a question. Of course, be careful not to sound arrogant or aggressive. Be sure you are always listening to and empathizing with the other person. The next important communication skill is non-verbal communication. Your body language, eye contact, hand gesture, and tone of voice color the message you are trying to convey. Eye contact is also important. You want to look the person in the eye to demonstrate that you are focused on them and the conversation. However, be sure not to stare at the person, which can make him or her uncomfortable. The third important communication skill is respect. People will be more open to communicating with you if you convey respect for them and their ideas. Simple action like using a person's name or call them by Mr., Mrs. or Miss depending on the person's marriage status will show that you respect them. Making eye contact and actively listening when a person speaks will make the person feel appreciated. Make sure to avoid distraction and stay focused on the conversation so the person doesn't feel offended. Last but not least, listening is one of the key points when it comes to communication skill. Being a good listener is one of the best ways to be a good communicator. No one likes communicating with someone who cares only about putting in their 2 cents and does not take the time to listen to the other person. If you are not a good listener, it's going to be hard to comprehend what you are being asked to do. Active listening involves paying close attention to what the other person is saying, asking clarifying questions, and rephrasing what the person says to ensure you understand. Through active listening, you can better understand what the other person is trying to say and can respond appropriately. Thank you.
Hello everyone, I'm FIKRI. I would like to share about the important skill for filling and dispensing medication.
Next is essential step when preparing medication by AZIF JASNI.
Next is important communication skill by IQMAL FAHIM.